Is it true that blood pressure should always be 120/70? Why does it rise in the morning? And can high blood pressure be diagnosed after just one reading? In this video, we'll talk about the most common mistakes when measuring blood pressure, why consistency is so important, and when it might be time to discuss treatment with your doctor, if it's actually needed. Why morning readings can be misleading. Many people check their blood pressure right after waking up and see numbers like 140 to 150/90. That can cause panic, and some start taking strong medications even when it's not really necessary. In reality, blood pressure often rises a bit in the morning. After sleep, the body wakes up, your metabolism speeds up, and hormone levels increase. That can naturally raise your blood pressure by 15 to 20 points, and that's usually considered normal. That's why, in some cases, it's more helpful to check your pressure 1 to 2 hours after waking up, once you've moved around a bit and started your usual routine, not immediately after getting out of bed. Share this video with someone who checks their pressure in the morning. It might help them avoid unnecessary worry. When medication might not be necessary. Sometimes people are given strong medication just because of one high reading in the morning, but these drugs can have side effects, muscle pain, fatigue, brain fog, or even joint pain that feels like arthritis. If your average pressure is around 140 to 150/90 and you feel fine, no headaches, chest pressure, or other symptoms, that alone may not be a reason to start medication right away. But every decision should be made only after discussing it with your doctor. Everyone has their own normal. Thinking that everyone's pressure should be like an astronaut's 120/70 isn't quite right. That's a great number for young, fit, calm people. But for many, especially after age 45, slightly higher pressure can still be normal. And forcing it down too fast with strong meds can actually cause discomfort or side effects. For example, people who naturally have low pressure might feel unwell even at 120/70, and for others, 140/90 might be their personal normal. When is treatment really needed? Treatment is usually considered when pressure is consistently above 150/90. Especially if there are other symptoms like chest pain, shortness of breath, nausea, or frequent headaches. In some cases, lifestyle changes can help lower pressure, like regular walking for 30 to 40 minutes, light physical activity, breathing exercises, or relaxation techniques. These steps help many people support their heart health, but everyone is different. Always talk to your doctor before making any changes. An exception: when your pressure is usually low. If you're used to having blood pressure around 90/60, then even 120/70 might feel high. In that case, your normal could be different, and that's another reason to speak with your doctor. A few tips for more accurate readings. Don't take a reading while walking around or feeling anxious. Give yourself 5 minutes of rest before checking. Try taking readings at different times of day to see the full picture. Blood pressure is a very personal number. A single reading doesn't show the full story. Watch your overall trend, pay attention to how you feel, and if you're unsure, always talk to a healthcare professional. What are your usual blood pressure numbers in the morning or during the day? Do they change with stress or weather? Share in the comments. It helps us and others too. And don't hesitate to ask your questions in the comments. We try to reply and create videos based on topics that interest you. Subscribe to our channel so you don't miss new high-quality videos about vascular health, blood pressure, heart care, and more. We create content that makes understanding your health easier and clearer. Take care and stay healthy.